So we are fortunate to have with us today Susan Blacker, a clinical social worker and educator in the field of palliative care. And she is also the Senior Director of the Cancer and Palliative Care Program, Planning and Performance at Sinai Health System in Toronto. So thank you, Susan, for joining us today.
Delighted to be here. Thank you.
So, Susan, as we're talking about palliative care, I'm sure many people want to know what is meant by the term palliative care and who does this serve?
So the question, what do you mean by palliative care, is a very important one. And there sometimes are some myths and misconceptions. So I'll start by saying that palliative care is really a special kind of health care for people who are living with life-limiting illnesses. The goal of palliative care is to focus on comfort, and sometimes we call that symptom management, as well as helping a patient and their family have the best possible quality of life. It's an approach to care that recognizes that living with a life-threatening illness can result in physical, emotional, practical, and spiritual needs. And we need to think about all of those things in order to provide holistic care. Palliative care is commonly used in care for people living with diseases like cancer or advanced heart failure or respiratory diseases or kidney diseases. We also talk about palliative care in relationship to advanced Alzheimer's disease or AIDS, ALS, or multiple sclerosis. So you can imagine that palliative care actually is needed quite extensively within our healthcare system.
So as we are learning more about it and are hearing it a little bit more now, I would say, what would you say are the main benefits of palliative care?
I touched on, the focus of palliative care is really on what matters most to the patient and family, given the circumstances and the reality of living with a life-limiting illness. And so that focus might include improving quality of life. It might be reducing or relieving physical or psychological symptoms like depression or anxiety. It really focuses on helping a patient have a more peaceful and dignified death and providing supports to the patient and family, and really importantly, focusing on those who are part of their caregiving network. We know that the role that family caregivers play is extraordinary, and they need help in doing that. They need the expertise of members of a healthcare team who can bring their expertise and really support them in their dying process. And those are really the benefits of palliative care.
So who would be involved in providing palliative care?
So because palliative care is very comprehensive and holistic in nature, it's going to depend on what a patient and family's needs are of who's going to make up the team that's providing palliative care. Generally, we can expect that there'll be a physician or a nurse practitioner and a nurse that provides care in whatever setting care is being provided in. It's very common to have a social worker involved and perhaps also a spiritual care provider. There may be a pharmacist who's been involved in terms of helping identify best possible medications and looking at how to reduce side effects. Many palliative care programs have specially trained volunteers who are a part of their team. And so a patient and family could expect that a volunteer might be part of a program called hospice, which may be providing services either in their home or in a residential hospice. If we were looking at somebody receiving care at home, there would also be individuals like personal support workers who would be involved as part of their care team. In some settings, like a palliative care unit, there might even be an occupational therapist or physiotherapist. And for some patients, there might even be a consultation provided by a speech-language pathologist or recreation therapist.
So Susan, as someone might be hearing more about palliative care or is seeking to learn a little bit more about it, how might someone access palliative care services?
So if a patient is wondering about the role that palliative care might play in their care, I would suggest the best starting point is to talk to the healthcare team already providing care. That could be a family doctor or a nurse practitioner. It could be a specialist, an oncologist or a nephrologist or a cardiologist who might be involved in treating them for the disease that they're living with. It might be talking to the nurse that's involved in their care. If somebody's receiving care at home, talking to their home care coordinator would be another great place to start. And if they're in the hospital, they certainly could talk to a social worker like me, who could give them some information that's going to help them understand what the range of services are that are available. There is information for folks who are looking for general information about palliative care and specific diseases on many of the websites that exist, like the Canadian Cancer Society, the Alzheimer's Society, the Heart and Stroke Foundation. And there also, in most provinces in Canada, is a provincial or territorial palliative care association, which would serve as a place they could learn more about the services that are available in their own region. There also is a terrific website for the Canadian Virtual Hospice, which provides all kinds of information about palliative care and topics that may be of interest to somebody who wants to learn more. And there is also a hospice palliative care information line that's run by the Canadian Hospice Palliative Care Association. And so someone could call 1-877-203-INFO and ask questions and learn more.
We are in an interesting time period right now, being in a pandemic. What role does palliative care play during this time, and what does that look like for folks who are wanting to receive palliative care services?
So palliative care has been playing an incredibly important role during the course of the COVID-19 pandemic. We have seen many palliative care providers working alongside their colleagues for those patients who are very seriously ill. And some of those conversations may be about how to provide best symptom management, but also how to have conversations about hard things that maybe patients haven't talked about before related to goals of care, what they would want to have done, what they wouldn't want to have done. And so we've also seen that many individuals who are sick but not with COVID have needed to access more support from the community. They may be frightened about going to a healthcare organization and are really seeking to receive care for as long as they can remain at home. And so the role that the palliative home care programs are playing has been very, very important.
Susan, I want to thank you so much for taking the time to share with us about palliative care. I think there's a lot of questions that have been answered, and I really appreciate you taking the time to be with us.
Great. It's been a pleasure. Thank you very much for the opportunity.